Hello, everyone. After 2 weeks, hello, and I'm back. Thank you. Thank you very much for again joining the group. I just double checked this morning. We are already at how many is this? Oh, 800. 867. I think it's moving into 870, but thank you. Thank you very much for being here. It is your coach here again. And of course, we have a new set of things to be answered today. It's been a while, 2 weeks, that I wasn't able to run any drills and activities. It was a hectic week for me. Classes here when it comes to our level 2, level 3 students. And then I also had a class in the Philippines and a special class and coordination as well with one program in Australia. So your coach has been everywhere. But nonetheless, we're back at it again. And right now, we are actually going to answer the exam that I have set for you for the last 2 weeks. Thank you very much for everyone who were able to go to the test moss and answer those questions. So those questions are essentially our trending topics questions. So every now and then, every end of month, just like much like last month in June, I will compile some of the most common concepts that are being encountered by everyone in our group who have faced the NCLEX. Okay, just to clarify, these are not the actual questions. Okay, don't get your hopes up that this is the actual questions because we can never ever get that. And of course, I don't want you guys to give this false hope that, oh, this could be a question in my exam. More likely, it could be a concept that could also be in your exam. So what they are actually sharing are the ones that got stuck with them. No concepts that are essentially very much focused on the current trends on how healthcare is happening, not just in the United States, but in any area wherein NCSBN has jurisdiction with. So I want you guys to be exposed to those concepts, to narrow down your things to study, pointers to review, whatever you might call it, as well as to, of course, give that little bit of organization in your preparation. So these are 40 items, and this has been answered. How many do we have here? Oh, it's already been answered by at least 81 people. Okay, so the free exam is still running. I didn't close it so that everyone would be able to connect with it. And I'm also going to put the TestMoss link at the end of this video so that for those who are not yet able to take it, go ahead. So this will be at least a 4-part rationalization as well as that of drills assessment in order for you to practice these questions that are at NCLEX level. And then eventually, in the next few weeks, we will also, I've already finished, I seek the support of a friend of mine in order to design something wherein the actual UI or user interface that we'll be using is as close to the format of NCLEX itself. So yes, we're putting it there just for the purpose, of course, of our advocacy. So don't forget to actually like and share all of these initiatives in order for us to have more nurses in the fold, especially for those who could not afford all of the stuff that is needed when it comes to preparing for NCLEX. Okay, so right now, let's move on with our activities. Let me just share the screen here that I have. First off, thank you very much. Again, this is now for the 600 people who have joined my TikTok. So a friend of mine actually opened up a thought that why not post this on TikTok, and I've been posting for the last 3 weeks, and not actually not only the last 2 weeks, and it's already been I think 600. Oh, I was actually surprised. I'm looking at it in my phone right now. It is it's 700 plus. Okay, 700 plus likers as well as that of followers. So we're also doing waves there. I am actually splicing some of the concepts here so that it could be ready to go in your TikTok format. So see you there, guys, as well. Again, spread the word that we have this kind of initiative. You don't need to, let yourself struggle primarily when it comes to payments, as well as that of activities like, and as well as scrupulous scams that could, oh no, trap you into paying huge amount of money and then you'll get nothing in return. If you're going to do a DIY of your review, I will be happy, and our group will be happy to help you around. So shout out to Sir Michael, who is also already in our group as well. He has been with me for the last, I think, more likely 8 years already, and has been doing the same thing when it comes to supporting and helping nurses when it comes to their NCLEX. And also a shout out to some of my students who are now the leaders of EXL's Healthcare Academy, and they were able to produce a lot of passers as well. So nice job for you there, guys. I am very, very much proud of you. Okay, so moving up as well, I just want to remind everyone that we still have in our group, okay, our first module. I'm actually on the verge of finishing the second module, which is essentially the AURN. I think I was able to, oh yeah, I was able to post that one as well. So I will be also sending out modules that could help you in your preparations, even as well as that of your credentialing needs, meaning in order for you to set up your papers and get your NCLEX ball running. So this is the first one that I have. This is a high impact success plan that will run for 2 months. So 2 months of preparation capacity as well as planning, especially for those who doesn't have enough time to actually give to your review efforts. So who are this? Okay, nurses who are also working. So our nurse tech friends there, our CNA friends there, who are actually on the final weeks as well as final time of their BSN or ASN, Associated Nursing. Studies and about to take the NCLEX in the next 2 3 months. This one is for you, for all moms and dad nurses there who had been messaging me nonstop to help them in their preparation. This is my answer for you. Download it now. It is on our group in Facebook as one of the files, and it will be very helpful. In fact, I already placed an August, or rather a July to August plan there for anyone who would want to use it as reference. It also has a step-by-step activities and considerations that will be useful for each week that you're going to cover for that 8 week high impact program. Because in most cases, and based on the study that we've also run on the very first organization that I was helping out with NCLEX, the effective preparation timeline in order for you to have a high passing rate in NCLEX is at least 2 to 3 months. But also we need to take into consideration that there are things that is happening on the side. So this is the one. And then we also have the path to the AURN, which is an Australian RN registration. How are you going to kick off your OBA activities? And that will be very helpful for you, for those who are actually eyeing to go to Australia. Our friends in India, as well as some of our friends in Southeast Asia, not just in the Philippines, but also in Nepal, Vietnam, as well as that of Thailand, who would want to have an Australian registered nurse track. That is also for you. Okay, the next one we have that is actually coming in will now be a deep dive, and this will be next week. I am finalizing it as I am speaking right now. This is now a deep dive of the NCLEX as a whole. So this second module would be focusing on the management of care in NCLEX, which is essentially the bulk of your NCLEX. If I'm not mistaken, based on the latest test plan, 30% of your questions will be coming from here. So this will give you a deep dive on the concepts as well as that of the things that you could expect with this kinds of question strategies on how you're going to answer it. And eventually, I'm also going to make all of this as a book that we could use as a general module for everyone. Okay. So something to ponder on and prepare about. Again, just like what I tell you and just like what I told you, I am going to do everything in my capacity to actually help you in your preparation. So unlike, I'm not putting myself above everyone else, but one thing that I have known for almost 13 years or more than actually 13 years of doing this advocacy, you guys, especially those that would need do it yourself training as well as that of preparation for NCLEX, requires every help that you could get. And I will be very happy to give it to you. On top of that, this is not only for our NCLEX takers, okay, guys? It's not only for your NCLEX takers, it's also for anyone who is struggling in nursing. I'm also planning to discuss after the main concepts of NCLEX, the clinical judgment in a deeper concept. Okay, so without further ado, let's now answer the first 10 questions on your NGN trending topics. So this is part one, and I will have another one yet tomorrow so that you will have a good start of your week. I know it's Sunday now in the Philippines, so it will be a good start of your week from Sunday, Monday, Tuesday, three or up until Wednesday for you to have everything in your arsenal to practice when it comes to NGN level or NGN difficulty based questions. So these are again trending concepts that had been encountered by some of those who were able to successfully and of course unsuccessfully take NCLEX. Okay, I'm not gonna sugarcoat anyone. We do have people who weren't able uh, to pass it as well. But we do have, and I want to celebrate the 11 people. I'm not sure how many, if there's more, because there's only 11 people who had been messaging me in Facebook who were able to pass. Again, guys, it's not me, it's actually your efforts that made it happen. So, congratulations. Welcome to the nursing world for every one of you who are about to embark there, moving forward with your success. And I'll be happy to now see you in our actual deliveries one day, or probably one day if we're going to work together. Okay, so moving forward, let's begin. How is the result of this exam? Okay, so this was just the 41st responses that I was able to get last Friday. Right now, 30 more, rather 40 more people was able to get it because I shared it over TikTok, and we're now having 81 people who were able to get it, and the score is almost the same. 40% to 45% in general are the overall result of people who are going to take it. So this actually is an indication of proof that the difficulty of the questions that we are going to answer on this type of exams that I'm going to prepare for you is aligned with NCSBN. Okay, these are not copy pasted questions coming from books or from review materials. So this is something that I took time as well for you guys to actually answer. So this is like generated. So I'm taking time at least 15, 10, or rather 15 to at least 30 minutes of my time a day just to create this one. So this is like a whole month preparation of the questions. So this is something as well that could give you a little bit of a heads up of the most common concept that you might encounter in your exam. But again, in general, NCLEX is everything under the sun. So let's try to answer each and every one of them, beginning with this first question. Again, this is random. This is not on any specific order, but most of the questions that you will see at the beginning of the first two parts are actually the top 20 questions wherein a lot of people got it wrong. So more likely, this is something that we could ponder on. Okay, let's begin with number one. You have a client who has been admitted with catheter-associated vancomycin resistant enterococcus. So essentially a VRE, one of the most resistant bacteria that actually is a nosocomial infection, because in most cases, this is due to Foley catheterization. That's why here if you're in the US, we had a daily, in fact, Q-shift catheter audit just to prevent it. This is what you call a catheter-associated urinary tract infection, which could cause a lot of problems, especially with your elderlies, as well as compromised population. Now, the question is, what would be the interventions that we are going to implement? Okay, let me just close my video here and move on to the PowerPoint so that we could have. There we go. That's a lot more better. Okay, so I have Kirby here in my background again. Okay, so let's begin. When you're talking about a multi-drug resistant MRSA, okay, Staphylococcus aureus, or a vancomycin resistant enterococcus, this will be considered something that is a, oh, sorry. This is something that we would consider as a contact, okay, transfer. Therefore, in terms of PPEs as well as that of precaution, this is also going to be a contact precaution. So most likely, this could create, okay, this could be transferred when you are holding it, okay, or you got exposed primarily to the source, which could be a urine or a stool. So one thing that I would want to emphasize with you guys, this type of condition is more likely in the hospital. The reason why NCLEX is asking this kind of concepts is that this would want to test your awareness in how are you going to prevent unnecessary infection and problems for your patient in the unit. Okay, and remember, NCLEX was designed to test you guys not on the perspective of what you know about NCLEX, but on how are you going to practice with that knowledge that you have when it comes to nursing. Okay, so with contact precautions at hand and with all again SATA as our question form, again, main technique, convert it into a yes or no argument, particularly focusing with your choices. So in a contact precaution, are we going to keep a dedicated equipment for the client? That's the test taking strategy. Is it a yes? Of course, if that is a yes, then we include it. Are we going to perform hand hygiene before exiting the room and removing all of your PPEs? Okay, that is a universal precaution that is applicable with anything airborne, contact, droplet. Okay, specialized precautions when it comes to neutropenic, you always need to perform hand washing. Therefore, it is also included. Now, can they not have a visitor? Can they not have a visitor? Hmm. Of course not. They can have a visitor. So this is a wrong statement. So no, essentially we're not going to include it. Are we going to wear a face mask in the room? Okay. Especially if this is only catheter associated, okay, this is not airborne. So you cannot get it by inhaling it. There might be some, unnecessary smell. And just like one of the questions that I was answered about a few weeks ago, you could wear mask only for your preference when it comes to the smell, of course, when you're about to be on an extended period of time with the patient. But in most cases, okay, we do not need, okay, or we do not need any form of mask in the room. So we could actually eliminate this. This is also a no. And then finally, is it necessary that we wear a gown? Okay. So when you are talking about contact precautions, it is something that could be, okay, even with a direct contact on your clothing. Therefore, you need to have your gown in the room. Essentially, gloves and gown are your most important PPE priorities. So A, B, and E. That is your answer. Again, this is how you approach the question. Break it down first. Get the subject of the question. Focus on the STEM and then do your test taking strategies, particularly eliminating every form of unnecessary answer. Again, the more that you eliminate, okay, the more that you guys eliminate the unnecessary choices, the better your chances of getting it correctly. Okay, let's now go into a prioritization focusing primarily on the care that you're about to give associated with poisoning. So this is a seminar on childhood safety, and the main thing that the question would want, which of the following would have the highest risk of poisoning? Okay, so let's go and deep dive one by one. Again, let's look and see it based on the developmental stages. Okay. So we are going to answer this based on what we know about the development stage or developmental stages on the growth and development spectrum of individuals. As we know, poisoning is something that is unique on early childhood. Okay? So the only time that it's going to be present as a risk for your adolescence as well as that of sometimes school age, unfortunately, is actually during the possibility of having suicidal intentions. Okay, so the thing is, again, in NCLEX, if you have something like this and you see, oh, a 15-year-old, an adolescent could be suicidal. No, okay? Whatever it is presented on your question, just as this, never, okay, never ever overthink it. It's a 15-year-old who likes to repair bicycles. As simple as that. No other strings attached. This type of questions essentially is focused on facts. So you need to get back on the concept of your developmental stage and what is factual when it comes to this set of choices. So a 15-year-old who likes to repair bicycles, okay? Having initiative, knowing already their own identity, because what? This is identity versus role confusion. Okay, so fixing his or her own bike is essentially getting into the responsibility. Okay, so that is actually an identity building capacity. That's why at adolescence, in a perspective of developmental support, we allow them to give decisions or get decisions on their own, while we adults, families, parents, teachers guides them accordingly on how the decision could be good. Is this a risk for poisoning? Of course not. Okay. So, just like what I told you, most of the poisoning are actually on the early childhood. By that fact alone, we could remove 10 and 15 because there is already a discernment. Okay, there's a discernment of what is right and wrong. So, we are now stuck between a 9-month old and a 20-month old. So, as you can see in the fact that we have in B, you have a 9-month old who stays with a sitter 5 days a week. I tell you, being a parent and someone who's about to have a baby, this might not trigger or expose my kid to poisoning, but this would probably expose my person or rather my child to personal neglect. So, what's the most important thing to remember in a 9-month old? Okay, their motor faculties. Okay, that's the fact with that developmental stage. Their motor faculties are still developing. They could barely stand. Okay, they could barely maintain balance. Some babies need to have support in order for them to actually stand up. Versus a 20-month old. So a 20-month old is this is a toddler. Okay. And as to some of my friends in the life coaching, again, the life coaching industry, we consider the toddlers as your what? As your raptors. Continually, okay, continually. I call them, even in the classes, I call them the raptors. Why? Because they're continually running and they are continually eating anything that they lay their hands on. So essentially, the one that would be at risk, and in most cases, poisoning in children is due to ingestion. Letter C is your correct answer. So anyone who answered this as letter C, you got it right. Okay. So that's how you approach this kind of question because again, these are facts regarding the concept. Do not overthink the questions, do not overthink the choices, stick with the facts. Next question. We now have again a community health nurse who is a member of a mobile crisis team and then are providing services to Hurricane 4 victims. So this is actually timely at the moment, especially for our friends or followers who are in Texas and Ruidoso. My heart and my prayer goes to everyone. Hope everyone there is safe. And for the nurses who are supporting them, heads up. I was once in your shoes as a reservist focusing primarily on disaster support. So I know exactly how hard it is. And of course, again, our prayers to the hundreds who have lost their lives, especially the young children who are affected with this. So I'm just giving a little bit of a respect. And hopefully, for those who've been watching, would also raise up their prayers. Now, this is actually timely. Why? Because disasters like that, and I've been through a lot. Living in the Philippines with 20 typhoons or hurricanes in a year would essentially be a common thing for you. But one thing that has a toll on this one is that it has a chronic impact on mental health. This plants PTSD. So, in order for us to immediately address that, we also need to essentially accept the fact that this could have chronic effects. Now, the thing when it comes to disaster is there is disorganization. You don't know where are you going to get your daily sustenance, your food. You don't know where you're going to focus on when it comes to your healthcare needs. You don't know how the children is going back to school. You don't even know how you're going to move forward with your houses. So with this one at hand, what would be the best thing that we're going to do? This organization can only be countered by centralization. So you centralize everything, establish your command center. This is the best way for us to kick off care. It would be hard for each and every caregiver to actually go door to door. Your social service agencies could not process anything as long as there is not a fixed number of people that they are intending to help. Because the social service will then weigh how are they going to align resources, especially in the people who needs it. And giving out flyers will not be the best thing to do because here you need to have focused education. You could not have someone read a pamphlet and understand it. You could not expect that to happen. So be very mindful on your decisions, particularly when it comes to centralizing everything. A central command approach has always been the gold standard for any form of disaster relief. Back in the Philippines, when we're supporting typhoons, we have a centralized area that could be either a public basketball court or a major school in the vicinity wherein people can come in. And there, in that centralized command center, you have support for psychological first aid, you have your relief, okay, relief materials as well as supplies that could help for days or at least 3 to 4 days of food and sanitation needs. You have their psychologists that would do stress debriefing after the psychological first aid. So I'll do a little bit of a discussion of that when we touch psych as we progress. Okay. But the main important thing, if there's disorganization, create a concept or a feeling of organization. Next question. You know a home health nurse supervising a home health aide who is changing a dressing for a client with a chronic heel wound or a deep tissue injury. Which action of the aide indicates adherence to appropriate infection control procedure? So this is essentially a good statement question. If you have been following me, this type of questions wanted you to check and evaluate what is essentially within practice. How are you going to see that the person is doing it correctly? And that's the one that we would want to answer. And again, select all that apply, yes and no technique. Now, letter A, let's begin. Is opening a sterile container 4x4 using the outermost corner to peel back over the cover. Is that the right way that we're going to do it? Some nurses are biting it and then, okay, there you go. Okay, so using the corner to peel it back, is that something that is within effective, appropriate infection control procedure? Maintaining sterile as sterile? It is a yes. Pull glove off over the soiled dressing to encase it before disposal. So I have a glove here for my pen. I put the dirty dressing and then pull it over like that and then to cover it. Is it something? If we have sterile to sterile, we also have dirty to dirty, especially when disposing. So B is a correct answer. Oh, let's save some unused sterile 4x4. Okay, any form of sterile material once opened is no longer sterile. Hence, it goes to your Okay, it goes to your trash. So we do not save sterile 4 by 4s. Non-sterile for the purpose of cleaning the wound. Okay, so your unsterile 4 by 4s, you could save it because that's only for clean. So essentially, when you have clean materials, that is only for the purpose of, okay, clean. It's also for the purpose of cleaning. Okay. But if you're going to change the dressing, it needs to be sterile. The one that will have a final touch, okay, on your wound should be a sterile material. So me being a health, rather, but a home health nurse for like 2 years now, it is a gold standard, and that is also how I'm training some of my nurses who are about to get on when it comes to wound care. Okay, clean at the moment that you're removing the dressing and cleaning it initially. The final cleaning after you have do a minor debridement of dead skin cells, pus, and all, you will now use your sterile one. So it's either a combination of a sterile 4 by 4 wet to dry that is actually soaked in a plain NSS, or right now the gold standard, because before in the Philippines we're doing the plain NSS, but because the gauze is actually being impregnated by the wound, we are now using Vaselinized gauzes, your zero form. So zero form on top of the skin, wet, okay, soak, wet soak 4 by 4s, ABD, Curlex, and then in some cases we're also adding up our elastic bandage. Anything that is sterile and not used, throw out. Unfortunately, that's the reality. We're like the most wasteful. We're the most wasteful profession there is. Now, wash hands prior to putting on gloves and after removing it. You never go wrong with hand washing because it's a universal precaution. Wrap silk dressing in paper towels? Of course not. This is not supposed to be the thing. Okay, it should supposed to be on a sealable, okay, bag that is also preventing drips. Okay, because you don't want any form of bodily discharge running across the floor. That could also be a source of infection, especially if that would be, especially if it's a chronic heel wound. This could be a MRSA for all you know. Okay, so that is your answers for this question. Now, since we're already speaking with hand washing, a quick select all that apply. This is now a procedural SATA. Okay, so there's no technique on this one. It is plain and simple. What would be the best time for you to do your hand washing? Chart entry? Not necessarily. The main goal of your hand washing is to prevent transfer of infection. These are very, okay, these are very simple, straight to the point question, but a lot of people got this wrong. Seriously. So, what are we going to do? After cleaning a wound, contact with the patient. Yes. After contact with an inanimate object in the immediate vicinity of the patient's room. Okay? The patient's room, so anything that is associated with pillows, okay? Seizure pads, restraints, even patient's phone that fell on the floor that you need to take. Okay? Need to do your hand washing. Of course, prior to eating, because every form of your problematic bacteria could be GI in nature. And the next thing you know, you have spores of C. diff. And you all also have C. diff. So for our nurses there, I know some of us will be eating in the next, I'm going to my shift as well in the next few minutes. Some of us are actually going to eat. Okay. And eventually try to wash your hand. Nothing is safe when it comes to C. diff and not washing your hand. That's like the perfect combination for you to have C. diff. And I have a couple of nurses across the years that have encountered it. We could go in a hurry, but we need to still focus on how are we going to make ourselves safe. And of course, before having any contact with another patient to ensure that there is effective infection control. Next one, we now have a meningococcal pneumonia, which implements which transmission-based precaution for the patient. Okay, meningococcal pneumonia is a droplet precaution. Okay, so especially if there would be discharges in the upper respiratory tract, okay, nasal discharges, mouth discharges. So how are we going to answer this one? Okay, let's see. Let's use your facts elimination again. Okay. Is it a factual thing that personal respiratory protection devices needs to be done? Okay. Could it be personal respiratory protection devices? Yes. Okay. Yes. Private room with a negative airflow pressure. This is specifically for airborne. Okay. Mask worn by staff when the client needs to leave the room. Is it the staff who needs to wear the mask in droplet precautions? No, it's not. Okay. So D is not the correct answer. C is not the correct answer. It is the patient who wears the mask when he moves or gets out of the room. Now, what would be the best thing to do? In your infection control, okay, the main concept that you need to understand here is that we need to implement actions that has the greater impact. Okay, we need to do activities or prioritize activities that will have a greater impact, and nothing, okay, has more greater impact than A. Cohorting a client, both meningococcal pneumonia in one room, or place them effectively in a private room. So why is not personal respiratory protection devices? Okay, because the mask that the patient would wear is only his or hers. No one is going to use it. But if you got the wrong idea to actually place someone with meningococcal pneumonia somewhere that is intended to be open, let's say, for example, an open ward in the Philippines, or let's say, for example, in a shared room wherein one doesn't have an infection, you will be spreading it. Okay, so yes, personal respiratory protection devices is necessary, but the one that you will need to prioritize to prevent the infection from spreading is letter A. Okay, that's your answer for this question. So a school nurse is providing morning assessments for teachers at a school where a 10-year-old child with epilepsy attends. So now what we're going to focus on, what is the most important action a teacher can take when a child experiences tonic-clonic seizure in the classroom, something that is very close to my heart with me being an epileptic. So what would be the best thing? What we know about tonic-clonic seizures is that these are also what we call originally as grand mal seizure, okay? Originally and before this was actually what it's called. But the main purpose of this, or rather, when you're talking about tonic-clonic, this is systemic, okay? Stiffening, relaxation, and a continuous cycle of it for a person with epilepsy. So what would be the best thing to do? Okay, the best thing to do is place something soft and flat under the child's head. Protect the head. We do not restrain. Okay, we're not going to note the sequence of movement with the time lapse of the incident. Okay, that is something that we are going to do at at the entirety of the seizure, but that is not our main concern. The problem with tonic-clonic seizure is that this could also create unconsciousness. Okay. Oh, happened there. Why did I put a G? So you will have unconsciousness on this, and the next thing you know, the patient might hit, okay, their head on the floor. So we need to make sure that we lay them on the floor, let them have the seizure episode without restraining them. Another person will time how long the seizure had happened and what have been the characteristic of it. But again, our main priority is not to have any head injury. Clearing the immediate area of anything that could harm the child is also a priority, but in most cases, again, we prevent falls. Okay, it's not that the seizure would suddenly happen and then the child will fall. Sometimes there could be signs, there could be an aura associated with tonic-clonic seizure. So laying him down and then preventing any form of head injuries will be your top priority. Then you will have to do B, then you will have to do D, and finally you will have to do A. That's how you actually prioritize this question. C, B, D, A. Okay, so that's how we approach it. And don't have to worry about it. Don't think about this on a Philippine, Indian, Vietnam perspective. Okay, every classroom here in the US has an educational assistant that is supporting the nurses, or rather the teachers. So do from there. Okay, they have someone to support them. So don't look at it in the perspective of another country. Look at it in this perspective. Okay. A nurse performs morning assessment and obtains a urine specimen for a client with MRSA who is on a contact precaution. Which thing would a student nurse perform that would need a nurse intervention? Meaning, which is a wrong action. Okay. Let's try to eliminate everyone. Let's begin with A. Cleanse the disposable stethoscope with chlorhexidine. Is it chlorhexidine? No, this is automatically wrong. I think I gave the correct answer already. In any form of equipment, we use bleach. In any form of skin cleansing, we use chlorhexidine. Okay? So that's how we approach it. Again, skin, chlorhexidine. Equipments, okay? Equipments would be bleach. Remove the urine specimen cup from the room in a sealed biohazard bag. That is correct. Okay, so you're not gonna do it because again, we're looking for a wrong thing. Scrubs the Foley collection port with alcohol for at least 15 seconds within standard. Use an alcohol-based hand antiseptic solution after removing gloves. This is also per standard for hand hygiene. So again, chlorhexidine, skin, bleach, equipments. So the nurse is offering safety instructions for a parent of a 4-month-old infant and a 4-year-old child. Which statement indicates the correct understanding of appropriate precautions to take for the children? So what are the correct ways of dealing with children at this age? So you have a 4-year-old, hold and help feed the 4-month-old. Is it something that we could do? Place my infant in the middle of the living room floor on a blanket to play with my 4-year-old while they are unattended. Strap the infant car seat on the front seat, facing backward. My sleeping baby lies so cute in the crib with a little buttock stuck up while in the air while the 4-year-old naps on the sofa. Okay. So let's take out. Is cohabitation with the children as well as letting them play with one another be a good thing? Letter A? Yes, it is. Placing an infant in the middle of the living room unattended? Of course, common sense will tell you this is wrong. Infant car seat never goes on the front seat. They are on the back. So you remove it. So between laying or allowing the baby to sleep on her tummy versus having them, okay, cohabiting them or having them the ability to interact, what would be the best answer? It would be A. Okay. This would essentially cause sleep apnea for the patient or for the baby. So you don't allow a 4-month-old to lay on his tummy. You see, little buttocks stuck up in the air. Not a good idea. Okay, so A is your correct answer. Then we now have the final question. The nurse is caring for now an agitated client with dementia who is pulling oxygen and IV tubing. Wrist restraints are already applied after less restrictive safety measures had been ineffective. And now, what are your appropriate actions to protect the client from injury? This is now restraint management. So we just don't restrain people. We need to make sure that they are safe. That is the same thing, or rather, that's the most important thing for restraint. And in fact, we could do this primarily with your Q2 evaluations, your activities that is associated when it comes to safety focus. Now, with all that at hand, let's put a yes or no. Attach wrist restraint straps to the upper side rails. Okay? Is it on the upper side rails? Okay, no, it's not. Okay, you don't apply it on the upper side rails. You are going to put it on the associated bed frame attachment for your restraints. Position the client supine to keep restraint straps taut. Are we going to put them in supine position? Of course not, because this could also create difficulty of breathing. That's why we need to have the head of bed elevated at least 25 to 30 degrees. And especially for people with dementia, you are actually going to think that there's also a possibility that this could be triggered by stroke. So you need to have the head elevated. Release restraints at a regular interval and assess behavior. Q2 checks and loosening of restraints? Yes. Use a square knot to tie restraint straps in bed. Right now, we don't do the square knot anymore because we have the chin straps as well as that of the clip, making it easier for it to pull. But for classical things, and based on as well on our standards, based on the literature, square knot with one pull is good. And finally, using a gauze pad to monitor prominence under restraints is not actually, okay, this is not actually considered because this would create pressure and friction source. Okay, so that is our first 10 questions. Hopefully, you were able to get some tips. More ahead tomorrow with this rapid drills that we're gonna do, and hopefully you'll learn. Share the word, guys. We have more to come. Thank you, and have a good day.